Would I be a good candidate for hairline lowering or hair transplant? At the very top of my hairline, it goes back about an inch or so. I feel like the aesthetics of my face would be improved by having my hairline blend better and not have this gap. It's almost a reverse widow's peak. I don't want my entire hairline lowered, just this small area at the top. What would be the least invasive way to fix this? Do you think it would help my overall appearance?
Thank you for your question. You've submitted some photos and you describe in your question how you have a situation where you have like a reverse widow's peak and you want to see the hairline in a specific way lowered, and you're asking advice about this strategy and whether it would be of value to you. Well, I can certainly give you some guidance. I'm a board-certified cosmetic surgeon, and I've been performing hair transplant surgery for over 20 years. I'm also the founder of TrichoStem Hair Regeneration Centers, a non-surgical alternative to hair loss surgery using regenerative medicine technology. And much of this has developed from the way I used wound healing materials for hair transplant surgery. So, to give you first an idea of how we do our consultations for patients like yourself, to begin with, we want to first establish, is there any evidence of hair loss? Is this something you've always had, and has it been stable? And with the assumption that that is the case and that this is a genetic trait, well then we've at least established stability. If there isn't stability, if there is progression or some type of receding of the hairline or thinning of the hair more globally, then we talk about some methodology for stabilization. And for women, hair regeneration in our practice has been very successful at helping more than 80 to 90% of women stop their progression and improve the density of their hair. Now, that being said, a strategy has to be undertaken with the one simple understanding. For you to have the kind of hairline that blends well with your existing hair, you have to achieve a certain density. Now, that density most of the time takes more than one surgery, and there's a reason for this. When we do our evaluation, we literally draw little squares of square centimeters in the areas that we're going to cover. So we get an idea of what volume, what areas in terms of square centimeters we need and the number of grafts we need. Now, when we're doing surgery, we can really practically, and even with advanced wound healing technology and everything else being done correctly, we can't really transplant more than 20 hairs per square centimeter. That appears to be a physiologic limit because each hair has to have a ring of healthy skin in order for it to survive. Now, a lot of people boast that they can put a lot more hair in that same square centimeter, but how much of those hairs actually survive, I would suspect not as much as they would like. And inevitably, the donor area is still a limited area for both men and women, even though this is not a case of pattern hair loss where chances are you'll have more than enough donor area to be able to transplant the area that you need. But with that understanding, you have to think about it in with a long view, that most likely to achieve density that's closer to 50 to 75 hairs per square centimeter, to create that blending and not like an obvious line of hair that's not dense to hair that is dense, you're going to need about 2 hair transplants. Now, as I was mentioning, that we've done hairline lowering surgery for women and we've gotten very nice results, but I would also recommend that you also learn about the hair regeneration technology that I'm talking about, which improves the donor area healing as well as the survivability of the grafts. In fact, people come here from around the world who have had hair transplant already, and they try to get to us, and within the first let's say 1 to 2 months after the surgery to help enhance the results of their surgery by improving the survivability of their grafts as well as improve the existing thinning condition for people with pattern loss. And that's, of course, something that doesn't necessarily apply to you. So meet with qualified, experienced hair transplant doctors. I say meet with the surgeon. I find it kind of distasteful that a lot of surgeons just have sales representatives meeting people and then essentially scheduling surgery. There's nothing replacing a one-on-one consultation with the physician. And with that being said, once you feel comfortable and confident, then it's worthwhile moving forward. But understand that there is a long view here, and you have to decide for yourself if it's worth it to undergo 2 surgeries spread over a couple of years to achieve this goal. As far as the answer to the facial proportion question, in cosmetic surgery, and I perform facelifts and brow lifts, and we do non-surgical facial augmentations. There are various rules, such as the rule of thirds, and there's the golden ratio of phi. But ultimately, you want to see what fits your face and what looks right. So you may want to just try something maybe with a hairpiece or something, just to see how that looks. And if you like the way that looks and it looks natural, then it might be worthwhile for you to pursue this. So I hope that was helpful. I wish you the best of luck, and thank you for your question.